Welcome to Western Wisconsin Journal. I'm Meg Heaton. This has been a challenging year for everyone, but especially so for seniors like me who have seen themselves catapulted into a whole new at-risk status. My late mother-in-law was fond of saying that getting older is no fun. She wasn't the most cheerful woman around, but there is an agency right here in our midst that can help smooth the process. My guests today are from the ADRC, the Aging and Disabilities Resource Center of St. Croix County. Amy Roemhild, has been a social worker for the past 23 years, her entire career dedicated to working with the aging population and their many life transitions, specializing in mental health and well-being. She has been with the ADRC for the past 3 years as the Community Services Coordinator, overseeing things like transportation, services, and working closely with the 9 senior centers across the county. Renea Aeschliman has been with the ADRC for almost 20 years. She's also a social worker. She is the administrative assistant who works closely with all the programs and services offered through the ADRC, including the senior nutrition sites and the bigger events that ADRC hosts in partnership with senior center boards across the county. I'd like to welcome you both. Let's start by defining what the ADRC does in St. Croix County and how fortunate we are to have that kind of an agency.
Well, thank you, Meg, for having us here today. The ADRC assists those that are 18 and over and individuals that are over the age of 60 and their caregivers. 18 years and older with a disability. We provide a variety of services. We have 4 benefit specialists, 2 of which assist those that are 18 to 59 who have a disability and assist those individuals with applying for disability benefits, doing a benefit checkup and things like that, and other services that they may qualify for. And then we also have 2 elder benefit specialists that assist those that are 60 and over to do the same types of things, and they help them navigate the world of Medicare, which we all know is not a fun and easy world to navigate. So it's great to have those 2 benefit specialists within the ADRC. We also have what we call 3 information and assistance specialists or options counselors. Those are 2 terms that we use interchangeably. Those individuals help people with information and referral. They're looking for housing in the county, supportive care agencies. So those 3 staff members provide the clientele with that information. They're also the gatekeepers to the publicly funded programs, which those programs are the family care and IRIS programs to help pay for services within your home. That used to be the long-term support program years ago, but now is part of what we do. We also have a dementia care specialist, Kim Bauer. She was just hired prior to COVID and took Nancy Abrahamson's position. The dementia care specialist assists those who are caring for somebody with dementia, navigate the world of dementia, and also working with businesses in the county to have dementia-friendly communities. How do you get your staff to recognize somebody who has dementia, training them how to work with an individual who comes maybe into their store who has memory problems. They also work with the police departments, EMS, and things like that. We also have a caregiver support coordinator who works with the dementia care specialists and assists those that are caring for family members who may have memory loss or caring for a family member who has any type of like Parkinson's, cancer, any caregiver type supports that she does. We also have 9 nutrition sites throughout the county that do on-site dining, home delivered meals, then coordinates with what Amy does in the transportation programs, bringing people to and from the senior centers, also to employment, medical appointments, and things like that. I think I've hit all the programs, right, Amy? We have quite a few programs through the ADRC.
Yes.
I remember my former director saying that we were the best kept secret in the county. And a lot of people don't know who we are until they need us. So we kind of want to get out there before they do need us, and so that they know what we have to offer and utilize us sooner than later.
Amy, this year has been particularly challenging. What are some of the challenges that you guys have faced in doing your jobs?
Absolutely. Obviously working with seniors, our clientele, we get a lot of feedback from them. We've had a lot of conversations with residents in the county that, are struggling with different issues. It definitely complicated things when we're not able to have that face-to-face contact, that, one-to-one home visits, that, or even wearing a mask, that communication that is so essential behind a mask is a lot more challenging. We all know that, seniors thrive on relationships, one-on-one communication, and that has been a challenge for all of our programs as we've pivoted. Technology has definitely been an obstacle. Many of our, customers don't use technology, don't have computers, access to internet, and not something that they're comfortable with. So pivoting to those types of programs was a challenge from the start as well. That's definitely been challenging.
Yeah, because isolation and loneliness, is already an issue for people, and then to have this on top of it, and then the fear factor that goes into all of this.
Absolutely.
Have you been hearing from people as much, or is that kind of dropped off, or what?
No, we still, hear from people every single day. Caregivers, seniors themselves. We really, just myself personally, every phone call that you make to a consumer, anticipate having enough time, because many of them just need to talk. They want to have a conversation. They share a lot of information. When the pandemic first hit and we kind of went into safer at home, we actually reached out. We started making one-on-one phone calls to all of our folks that get home delivered meals, and reached out to them and just said, okay, if you can't get a meal, do you have a plan? Do you have support? Do you have a way to get groceries? And just kind of, assess what some of the identified needs were. And at that time, come a year later, many of those residents, their needs were met, but they're lonely. They're missing that contact with their families. One of the really wonderful things is that through our home delivered meals, we delivered every single day. We never had a gap in service. So, most of all of our drivers that deliver meals, whether they're paid employees or volunteers, we altered their means of delivery. Some drop at the door and knock and wave, and others sat on a chair and, watch the person come out and get their meal, but at least they had eye contact. A lot of them do garage visits, as they're delivering that meal. And, often that was their only contact, during this time, during the week. It's been very essential.
We actually tried to switch gears a little bit in keeping our seniors active and engaged with things. We switched to home delivered meal bingo. So every day you get your meal delivered, you have a little icon, and you put on your bingo card and you turn it in once you get 2 bingos. We also have started activity packets with all of them to keep their mind engaged as well. So there's search and finds, trivia questions, different packets that we're trying to keep them active as well. And the different senior center boards have done different things. Like for Mother's Day, we had a greenhouse last year donate flowers, and they gave flowers to the moms or any of the females that they delivered to. We did special things for Father's Day. Tried through that whole year to still keep connected to them and let them know that we were still thinking of them. Even though we were far apart.
Those are all great ideas and things that people don't realize are going on. One of the things that it puts me in mind of one of the things that you're working on right now, I believe, is the aging plan. And as I understand it, all ADRCs across the state are required to come up with an aging plan. Is that like every 3 years or something?
That's correct. Yep. Every 3 years we have that cycle.
It'll be interesting to see, how the experience of this past year impacts this new aging plan going forward. Would you explain what it is and why it's so important?
Absolutely. The aging plan is really, just as you mentioned, all ADRCs are required to have that. It's really mandated more, starting right from the top at a federal level through the Older Americans Act related to funding. So it is required that every state have an aging plan, and then every state in turns, has that with counties as well, that every county, every ADRC has an aging plan. And what it is that's really a kind of a bigger picture type project that you're looking at. What's your long-term vision for programs for evolution of aging services in your county? It's really about promoting local conversation, what's needed in St. Croix County. We can have a really great idea of something we would like to, pilot, something we'd like to try, but maybe that isn't identified as a need. Maybe the seniors who live here do not feel that is an important issue. So it's really a system that's supposed to gather that local input and really find out what the people who are aging in this county feel is important. And then the plan itself really takes those, that public comment, that community input, and then puts it onto paper, puts it into goals and how we'll achieve success in programs related to those concerns or identified needs in our county.
How do you go about getting public input? You mentioned that that's part of the process here. How do you do that for the aging plan?
Yep. So right now we have a survey that's on our website. Plus, we've also mailed out that survey to every one of our home delivered meal participants, our grab and go participants, and then we got those surveys out to all of the senior apartments within St. Croix County as well. We worked with our public information officer and were able to put something out on Facebook as to send people to that link. I also worked with, I think it was the Star or Hudson Star Observer. They have a Generations newspaper that they put together, or a supplement to the paper. Mm-hmm. So we have a little ad in there with the RQ code, so people can just scan that and go right in there and do the survey. And then we have some follow-ups that we have to do, because on that survey we asked people if they wanted to provide additional feedback that wasn't on the survey. So we will be following up with a few different people there as well. And we've also gotten our surveys out to our center boards, our Council on Aging and Disabilities. All of our members have that as well. So now this interview is to let people know, how they can provide us with feedback. It's not just for somebody who's over the age of 60. If you're caring for a parent who's over the age of 60, then you should complete the survey. If you're 55 and you have concerns of how you're going to be aging in the community, please complete the survey. I mean, it's not just those that are currently receiving our services. We want to hear from everybody.
What kind of questions are on the survey?
We asked what they feel the top three areas of concern are for them. We listed, I don't know, maybe 20 of them, Amy, wasn't it? And then
at least 10, transportation, housing, trying to think
loneliness, social isolation, access to healthy food, staying fit, understanding Medicare and Medicaid, those two different programs. It's a variety of concerns, but we did leave it open so that they could, if they had other concerns that weren't on that list, they could choose those. And then we asked them what they feel is important for them to stay in their own home, or what they feel is the biggest concern for them if they were to stay in their home. And then also what things have they seen in other communities that they would like to see in St. Croix County. We left two open-ended questions so that they could provide how they feel about things. We didn't want to drive it to where we were formatting the goals. We wanted the survey to be open enough for them to communicate their requests and their needs.
We also put it in our newsletter. Sorry. How many subscriptions do we have, Renee, for the ADRC newsletter?
Close to 5,000 that get mailed out. And that doesn't include, we print 5,000 of them. We have 4,300 that actually go mailed out to people's households. So it's it's a pretty big list.
And
In
it's
the
a good-
past,
it's a good
oh,
piece.
sorry, Meg.
No,
I'm
it's a
just gonna
great
comment
piece. I
that
get it myself.
Previously, we did kind of some listening sessions at some of our senior centers our last cycle, and really found that, that wasn't very successful, that, people weren't coming to share their concerns. And, we really, so this go around, we definitely wanted to obviously get more responses, but also really focus on that we have input from all communities within the county, from more rural to the bigger towns, that we're really getting voices and opinions from all over the county really became important. And that too, with the pandemic, we're not able to do as much face to face.
Sure. So what's going to happen with this input? Now, how long will you be taking this in before you start to work with it?
Sure. Renee, our deadline is kind of the end of May.
It was, yep.
Yeah.
But
So
this will collect input. I'm sorry, Amy. Regardless of when our aging unit plan needs to be done, we think it's still good to have input throughout the year and all of the time, because we found out real quickly with the pandemic that the goals that we set forth in the last aging unit plan that ends this year, we had to modify those goals because we weren't able to do the face-to-face things that we had planned. But Amy will talk about how we take all of this stuff that's being gathered, because we do have a deadline of when we have to submit our aging unit plan. So we do have to have a cut at some point.
Yeah.
But
The state does provide us with a timeline of when we have to have all those items gathered and kind of presented. And then, ultimately the plan gets approved by our ADRC council, kind of the big picture. But what we'll do at this point is, as we gather the good chunk of this input, then our aging unit team sits down and kind of reviews what are identified as the top concerns in the county, what feedback are we seeing based on that. And then, then we assess what goals, what are we going to do with that information? For example, I work with transportation, and, that is always a concern, that there's enough transportation options for folks that no longer drive, and rural versus city again, a lot of differences there. And so then we look at, what things are we already doing? What things can improve? What things hinder that? What things, maybe it isn't that things aren't available, but people don't know about them. So just really looking at what is identified as their concerns and how we put that into measurable goals. The state kind of provides us a goal template, and we have to really look at, SMART goals, that it's specific, it can be measured, it's achievable and really relevant. And so we kind of go from there. This year, the state has really encouraged it to be, that we're looking at the big picture. What is the goals for 5 years, 10 years, and really a little bit more of a strategic plan, if you would venture to say, but really kind of looking at the big picture. And then we have to really be specific of what strategies we're going to use to meet that goal, and what measures are we, counting how many rides we provide, or what specific thing are we gauging our successes at. So it's definitely a big process, but that's how that input really gets put into programs and actual events and programs in the county.
And what are some of the areas that you think are going to come up again, or have? Because this is how many years we've been doing it. It's every 3 years. Am I understanding that right? Every 3 years?
Yep.
So obviously some of the same topics come up all the time. Obviously transportation in this county is a challenge, always has been, whether you live in Hudson looking for a taxi, or there's no bus there, and then you get out into the rural areas, it's very difficult, right?
Right. And the goals that we have, the state sets forth what programs we have to have goals in. So there are we call it Title 3 or Title 3B, which is supportive services, and that includes in-home care, house or chore work, a variety of different things that the state says can be utilized in that title. So we have to find a goal in there. We have to find a goal in the nutrition. We have to find a goal with health promotion. And we also have to find a goal within the caregiver world. So the input that we get back from individuals or back in the surveys somewhat needs to fit in these areas. And if we get a goal that focuses on loneliness and how to work, okay, does that fit in the supportive services, or does that fit in caregiver? How do we formulate a goal that goes within those program areas from the input that we received? We also have to do, which is new this year, is advanced values, which is not something they've done. The state has asked us to do before, but we have to do both values that look at enhance ongoing community engagement. How are we as the ADRC going to keep the community engaged in what we're doing? What goals, according to the survey, are we going to do to keep them engaged so that their input is valued? And then how do we show them that we're valuing their input by creating a goal to do X, Y, and Z? We also have to do something that's person-centered. And that might go with our nutrition program. It might go with caregiver program. But person-centered has where it allows the individual to have more control of what's done. I don't want to say, for example, it could be in nutrition, it could be possibly a restaurant model where the individual has a choice of what they want to eat. Instead of like right now, when you look at our menus, you get the main meal, the meat, the vegetable, blah, blah, blah. So if you go to a person-centered model for your nutrition, then you're allowing them to order off of 4 different items possibly. But I'm not saying that's what our goal is, but that's an example. Another value they want us to look at, since they looked a lot at what's happening in society right now due to COVID, due to other social, economical type of events that have happened, we also have to do a goal that focuses on addressing a racial barrier, excuse me, to racial equality. So that goal will be looked at in many different ways, I think, throughout St. Croix County. We've discussed as an aging team that we don't have a lot of racial differences within our senior centers. How do we get that? How do we have more people coming into our senior center that might be of a different race or ethnicity?
Because they're definitely living here in the county. We know that the racial diversity.
But where are they?
Yeah, exactly.
And then another value that we have to look at is advocacy for our consumers, knowledge and skills related to advocacy. How do we get them to advocate for themselves? That could be through giving them literature on where they can go for, let's say they have a complaint about a business that they've worked with, the Better Business Bureau. How do you contact them? What is it you need to do? Voting. It's another big one. How do you advocate for voting? If you are homebound, how are you able to vote on the next election? What are the things that you need to do? So there's a lot of things that the state has pushed forward. And like Amy said, what is the big picture? What do you want your agency to look like in the next 3 years? And the goals aren't one that you just do, this is a goal for just this year, and then we have another one for the following year and another one. Our goal, we can have one goal that expands the whole 3 years. Sure. But just lots of steps that go to meet that goal.
Amy, I know that you have focused a lot of your work on mental health issues and stuff. Is there a component of that involved in the aging plan too?
Sure. There isn't a specific or separate area for mental health, but it's definitely something that we've talked about on our team as a priority. I think especially coming into the scenario after COVID and just combating loneliness, isolation, what that looks like for mental health services and specifically for the aging population. I think you had mentioned fear as well, and just what that looks like for people to re-engage into society, re-engage with their faith communities, re-engage with peers, and really ways that our services can help with that is definitely going to be a crucial component, I believe, to our plan. I think there's definitely that focus area. statewide, they're just formulating, but a Wisconsin coalition to end, it's called Wisconsin Coalition to End Social Isolation and Loneliness. So, it's identified all over the state, not just this county and rural versus, there's a lot of differences there as well. So definitely something that we're going to look hard at and, really will focus on in our planning.
So when is the deadline for the plan?
July. We have to turn in a draft on July. I don't know the exact date.
End of July.
Sometime in
End of July. Yep. So we turn in a draft to the state the end of July. So we will be collecting input up until the end of May, so we can take the month of June as a team and formulate our goals and our action plans and our steps, everything that needs to take place. So then we can turn that in to the state. It's not just our goals that are there. We also have to do a narrative on what our county looks like, our demographics, our aging population, all of that stuff is part of our plan. And we do post our plan. We are required to post the plan on our county website. Okay. So once we get it up and it's all been approved by the state and it's been approved by our Council on Aging, it will get loaded onto our webpage.
Because I would imagine it's important to the people who have taken the time and effort to fill out the survey or give you the information to know what's become of all of this.
Right.
Oh, yeah.
Right. And so there'll be a variety of ways I'm sure you'll look at it. Let's kind of conclude this with why this process is so important for the future of services in the county.
Sure, absolutely. I think first we just know that the population is aging, and demographically, St. Croix County's aging population is growing quickly. We obviously have some statistics that we anticipate it nearly doubling over the next 30 years. It's a fast growing county. And so it's really important that the services are there as our population grows, but also it's definitely related to funding, to secure the funds to have programs for aging services. Having a plan like this is essential to be compliant with getting those funds. But also we really want it to be, the best practice, that this is for the residents who live here and what that looks like, not just now, but in the years to come as people age.
Where does the funding come from? Are we talking about at the state level or here?
Yep, there's a variety of pockets, if that's what you want to call it. We receive funding through the state, which is actually federal funded, but federal funds that filter down to the state, they disperse it according to the services that we've provided. There's a formula that they use. So we have state funding. We also have county levy dollars, which is great. There's a lot of counties in the state that don't have that. We have county dollars that help fund our nutrition program, our transportation program, as well as our supportive care services. And we also have program income, or that's a bad name or bad thing to call it, but donations and participant dollars that have come in that also cover our all of our program funding.
Okay. And again, as we conclude this, do you anticipate that the experiences you've had professionally, the challenges you've faced professionally, along with what your clients have experienced, that the pandemic is going to influence what the plan looks like?
Definitely.
Yeah, absolutely. I think socialization is key. Many of the goals still revolve around that, about the personal contact. I know that's what many of us miss the most, the contact with consumers and, the socialization piece. So regardless of what the goal may be, I anticipate all of those will really be about getting back together and how we can help in person for our consumers.
And I'm hoping that, as a result of all this, that people will have much more empathy. Having experienced, a lot of people will never have experienced this kind of isolation before, not being able to see their families, and so that hopefully it will make people a little more empathetic about isolation, loneliness, reaching out to people, building community, doing all the things that you guys work very hard to do. And again, we are very fortunate in the state of Wisconsin to have ADRCs, and ours in particular, because I know you work very hard, because I have friends in Minnesota who don't have access to this. We call our Medicare chick every year, and I've referred lots of people for the help that you guys provide. So I want to thank you very much for taking the time. I know that you're very busy through the pandemic, and again, thank you very much. We'll look forward to, hopefully after the plan is drawn up, maybe we can talk again and see what you found out.
Yeah, sounds good.
Thank you.
Thank you
Thank
very
you, Meg.
much, and thank you to everybody for watching.